Hello everyone and welcome to this audio podcast. This audio podcast as part of the Chromulin series. This audio podcast as part of the Spectro integer. This audio podcast as part of a Storm Robotics production. In this audio podcast today, I look at I look at significant hematuria as part of from sort of published works in a clinical correlation publication from 2015. So significant hematuria. Hematuria is more usually divided into visible macroscopic hematuria and and non-visible or microscopic hematuria. These can be subdivided as symptomatic SNVH associated with lower urinary tract symptoms or symptomology, frequency, discomfort on voiding, loin pain, and suprapubic discomfort, and asymptomatic or ANVH, persistent ANVH, asymptomatic asymptomatic not asymptomatic non-visible hematuria is defined as having is defined as having greater than one positive result on a on a on a urine dipstick on a urine dipstick investigation. Persistence is thus defined as having two out of three dipstick investigations positive for non-visible hematuria. When there is a need to differentiate persistent invisible hematuria in the absence of proteinuria from transient hematuria, two out of three positive reagent urine dipstick investigations is regarded as confirmation of persistent invisible hematuria. A trace of blood on a urine dipstick investigation is not regarded as significant. Urine microscopy is not reliable in detecting non-visible hematuria, so it is not necessary to confirm non-visible hematuria in a laboratory environment. That draws this audio podcast to a close. This audio podcast as part of the Chromulin series. This audio podcast as part of as part of the Spectro integer. This audio podcast as part of a Storm Robotics production.